Welcome to the Smart Life. I'm Olga Villaverde. States and counties are now beginning to ease some of the shelter-in-place restrictions that were put in place because of the COVID-19 crisis. But medical authorities say we are not out of the woods yet, and some groups of people remain very vulnerable. Today to talk about this is Dr. Kelli Wells, Florida Blue Medical Director, Public Health. Doctor, the COVID-19 crisis is really unlike anything we've seen in our lifetimes. You have been a public health official at a county and state level, and for the last year or so for a health insurance company as well. So what is it about this particular strain of virus that is so contagious and such a threat?
So this is a difficult disease, and it's difficult because, number one, we're learning about it. So anytime you have a novel virus to address, we are learning as we go. And that is quite uncomfortable, probably more uncomfortable for physicians and clinicians who are learning to manage it than it is for anyone, because we want to be able to provide good guidance so folks can stay safe. So that certainly is a challenge. Initially, we based most of our recommendations on what we knew from similar viruses. And we've had to modify things as we have learned a bit more about the novel coronavirus. In fact, one of the most significant challenges about this one is the fact that it can be transmitted person to person before symptoms develop. So with most infections, it's really at the onset of symptoms that we are most worried about exposure and transmission. But in this case, it precedes it by about 48 hours. So that is very difficult to get your arms around.
Now, Doctor, we know that Florida is home to so many retirees and, of course, to seniors who could be at a particular threat for COVID-19. But we know you're very concerned about other groups of individuals who are at high risk. These are so-called high acuity. Can you explain that to me?
Sure. Very early, we recognized that those that are over 65 in our communities were at greatest risk. But very shortly after that, what we found was that people who have chronic conditions, particularly those that have uncontrolled diabetes, high blood pressure, other heart disease, chronic lung disease, and were emerging very rapidly in terms of having severe consequences. Those were the folks that were being hospitalized, were having fairly lengthy hospital stays, were having to go to the intensive care unit. And what we've discovered, again, as we're studying as we go, is that it is especially risky if you have multiple conditions and if those conditions are not well controlled. And so we've begun to provide guidance, really encouraging people to come, if they are to come into contact with COVID-19, you want to do so in your best state of health. So you've got to really tighten down your control on your blood sugar. You have to be sure that your blood pressure is normal and that your heart failure is under control because of the risk of severe complications.
Doctor, you're obviously a family physician yourself, and Florida Blue has a very large network of doctors and providers across the state. For those who are on the front lines, what are your concerns for our medical professionals and their current stress level, not just now, but even after coming out of this crisis?
There are so many ways that this is difficult for our healthcare professionals, and not the least of which is just the difficulty of having to constantly make decisions that really lives hinge upon, right? It's something that becomes a part of being a physician, but it is intensified significantly under these circumstances. And so in states, particularly where you've seen hospital systems be a bit overwhelmed, it's been especially challenging, to recognize a need and as a physician not be able to meet it becomes extraordinarily difficult in terms of stress level. The other thing is that this is one of those conditions or situations where, as a physician, you're never able to turn it off. And what I mean by that is, even when your day job ends, your neighbor has a question, right? Your church member may have a question. Someone in your community has a question. They want some advice. They want guidance. And so there's not the opportunity for healthcare employees to really separate from the crisis. And that can really take its toll in terms of just your ability to manage and to practice good self-care. I mean, in truth, it's what we do, and I think that no one would complain about doing it, but we certainly are beginning to see the strain in a number of healthcare employees, particularly the medical professionals who carry sort of the brunt of their responsibility. And so support for those physicians and clinicians is of paramount importance now.
Absolutely, and we thank them so much for what they're doing every single day. Now, in addition to public health, doctor, you have also spent much of your career working on the social disparities, and I wanted to talk about that for a few seconds, if you don't mind. COVID-19 has absolutely impacted some cultures and some communities more than others. So can you tell us maybe what you know in terms of why and how?
So in the case of COVID-19, what we're beginning to see and what's being reported across the country is that there are members of minority groups who, while they may be a small segment of the general population, they are overrepresented in those that are hospitalized with COVID-19, and they are overrepresented in terms of the number of folks who die. Now, anyone who has done work related to health equity and health disparities recognizes that the challenge with minority groups has always been that there were disparities in terms of outcomes with chronic illnesses. So remember the list that I gave you in terms of the conditions that cause worsened outcomes. Those conditions themselves are more prevalent in communities of color, and they are more likely to not be well controlled. So for the reasons I outlined, if you come into contact with the virus that causes COVID-19 with blood sugar that's out of control because you're not able to afford your medications, or because you don't have access to a clinician, or you have transportation troubles and can't maintain the things that are necessary for your health care, well, that then translates into greater risk. If you add to that the fact that how we behave about our health in many cases is rooted in our culture, our race, our ethnicity, there's some health behaviors that put folks at additional risk. I can say, speaking from as an African American woman, that I have to beg, plead, pull, prod to try to get members of my family to go and seek care because there is a reluctance. You don't want to, bother a busy doctor. You may be fearful of being exposed to something when you go to a physician's office, or you feel like it may not be anything worrisome. Let me lay down and see if it's better when I get up. And for years, I counsel people about those behaviors because that's how folks have strokes and heart attacks that are unmanaged. In this setting, that health behavior can translate directly into a catastrophic outcome.
Absolutely. I wanted to also share a message that you have said, and I love it, and I'm quoting here: public health is everyone's responsibility. I'm going to repeat that. Public health is everyone's responsibility. What's your message there to our viewers and to everyone regarding that?
It's so tremendous. As a family doctor, when I was taking care of my own patients, I felt that the most important thing that I was doing every day was empowering people to take proper action about their own health. Like that's really what you're in this for. I think folks see clinical skill, but really what it is providing information to you in a way that you can apply it to your life, and it makes it better. So in this scenario, I think the critical pieces really lie with the individual in terms of what you choose to do and how you allow yourself to be exposed to others. So when you're talking about an infection for which each one person who's infected will infect about 2.5 additional people. And in 30 days, that 2.5 people becomes 400 people, right? So the best first thing you can do is sort of own your own space. Empower yourself to, not worry about the stigma of being out in public with a mask on. Empower yourself to raise your hand if you develop symptoms, and exclude yourself from activities if that's the case, even if it means separating from your family. The hardest part of this, I think, is our elders and the fact we want to interact with them, right? The governor mentioned that, his family hadn't seen their newborn baby yet. But the best gift you can give your older loved ones is not to give them this. And so exercise your own strength, keep your distance, and let's wait for this, for us to get on the other side of this.
How do you think COVID-19 could change our lives, let's say in the long term, doctor, when it comes to just handling safety, protection equipment, illness, air travel? I mean, there's just a huge list.
I think it's going to have very far-reaching effects. I am I'm a glasses half full kind of person. So, certainly there are many, many positives that we are going to gain from this. One of the things that I'm going to celebrate early is I bet we won't have much trouble with folks getting their flu shots this year. I have been saying for years, that my mantra about what we can do to protect ourselves and protect people in our community. Sometimes it's us getting the vaccine that protects people around us. And so I think that'll be less of a challenge this year. So that's certainly valuable. But I also think, heightened awareness about how germs are transmitted is not, that's useful information. So as you travel, for instance, and you touch surfaces, I think we'll always kind of be more aware of that. And what I hope we'll find is that we'll see a decreased incidence of some of the other things that folks sort of think are routine infections to get, because this heightened sensitivity is going to help us, protect the communities from those.
Great information, Dr. Wells. Thank you so much for joining us today. I really hope we could talk again on the Smart Life in the next coming weeks with even more good news and more information for our viewers to have.
I would like that. Thank you.
Thank you. God bless you and stay safe, please.
Thank you.
Straight ahead, how to lower your risk for a stroke. The details next.
You're watching The Smart Life on the Health Channel on South Florida PBS. If you'd like to learn more, please visit the Smart Life page on our website at allhealthtv.com. If you have a question for our experts, please visit the Ask the Experts page or give us a call at 855-796-4475.
Don't forget to download the Health Channel app. It's available free at the App Store or on Google Play. Follow us on social media at All Health TV on Facebook, Instagram, and Twitter.